I'm Dr. David Langer. I'm chair of neurosurgery at Lenox Hospital, Manhattan. You're listening to Interview with a Surgeon Agent.
On this episode of Interview with the Surgeon, we welcome Dr. David Langer, chair of neurosurgery at Lenox Hospital and vice president of neurosurgery at Northwell's Health Western Region. He is professor of neurosurgery and radiology at the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. Internationally recognized as an expert in cerebral revascularization and cerebral aneurysms, his work focuses on diseases of the brain vessels. Dr. Langer's work has been featured in numerous peer-reviewed publications, and he has spoken nationally and internationally. He is one of the few cerebral bypass surgeons in the country. Dr. Langer has been recognized as a top doctor and best doctor by numerous publications. He is currently a peer reviewer for the journals Neurosurgery and American Association of Neurological Surgeons Neurosurgeon. He's also a founding member of the board of the Brain Technology Institute and an active member of the American Association of Neurological Surgeons and the Congress of Neurological Surgeons, as well as the cerebral vascular subsection of these organizations. He has appeared on CNN, Fox, ABC, and CBS, as well as the Dr. Oz Show. He is also frequently quoted in New York Times and numerous other print news sources. In November 2015, Dr. Langer was featured in the Wall Street Journal for his innovative technology to record crucial steps of patients' experience in hospitals.
Hello, everyone, and welcome to Interview with the Surgeon. Today we have Dr. David Langer, chair of neurosurgery at Lenox Hill. Doc, how are we doing today?
Haven't had a bad day in my life.
I hear you on that. So let's just jump right into it. What were your goals and aspirations during your residency, and how did those change during your fellowship?
I think my residency and fellowship was a continuum. I don't remember like finishing residency and saying, oh, my aspirations have changed. I think that in general, I've always been attracted to just doing good. That didn't change between residency and fellowship. I think I chose neurosurgery because I wanted to save lives and do something really exciting, relevant, challenging. Clearly there's an element of a cowboyish nature to the field that attracted me as far as like the energy of it, almost like an athlete, that got me interested in it. And also the endless challenge, the technology, the risk. So those were the primary drivers, but it all started with just wanting to do good for people. It was never about how much money I was going to make or, how much power I was going to have. It was always driven by the inherent feeling of I want to do something to help people and that I'm going to be challenged in. And that's where it started. And that was, my fellowship was really more of an outcropping of that. I actually originally was going to do a spine fellowship. I always loved vascular. My first wife and I were in Philadelphia where I trained at Penn, and there were no vascular jobs. And so sort of my fifth year of my residency, I was like, well, I got to decide. We kind of wanted to stay at Penn, but there were no vascular jobs there. And I decided I would do spine. So I had a whole fellowship lined up. And in the last year of my training, April of my chief year, like 2 months to go, my boss asked me to go with him to New York, like out of nowhere. And I totally upended my career plans. And in some ways that was really a bad decision. I really upended all the planning I'd put in. And so if there's a recommendation to young, which I think was a huge mistake. I mean, I made a series of bad mistakes with my first marriage, my first job. You have to know yourself. You have to be mature. You can't do what other people want you to do. You have to do what really is best for yourself. You have to know what makes you happy, and that you have to make sure that you choose a job not because you're making someone else happy or you're trying to solve for someone else's issues, that you're really focused on your own, inherent, almost like a mechanical approach to every decision you make. And also you need a mentor. You have to really find a good mentor, someone who really has your interests, even to the point of them being above their own. And I had none of that. So I really started out in a pretty bad spot when I left my residency in 1998. I ended up moving to New York, sight unseen, trusted my boss, who really, I trusted him way more than I should have. And I sort of started digging myself out from that really almost from day one.
So during that fellowship, what was your mentality heading into your first job search process, and how did that perspective change in the beginning years of your career?
I've never searched for a job. They always came to me. Even started my residency training. My chairman offered me a job outside of the match, so I never even interviewed. He liked me, and he took me as a medical student. And I just withdrew from everything. So I never did the whole residency match. And then when I took my first job, he offered me a job as a chief. I never did a job search. I just went. And then when I, our hospital closed, and I went through a series of disasters along the way. The first time I actually chose a job for myself was when I left that medical system and moved to Northwell. But I was recruited, but I wasn't really in a job search. They just called me and I knew it was time to make a move. And even coming to Lenox was all driven by me. I told them I wanted to go. I saw an opportunity here. They didn't recruit me. In fact, it went against the financial interests of the health system because I was leaving one hospital in the health system and moving to another one. So they had to pick up my salary on the budget of another hospital that now, really didn't want to. It was kind of like driven by my relationship with some of the C-suite people. So I started off with nothing when I got here. And in fact, most people didn't want me to be successful because it sort of was running against the grain of the overall mission of a number of different factors in the health system. So I've never really been through that. But having been through if I had to do it all over, I 100% would have done it differently. But yet I still ended up okay. That's why, I think that the lesson for me is that it's kind of like Amanda in Netflix. You have all these ideas and structure and you have an idea of what you want and you hope it works out. And then when, all of a sudden, life throws you a curveball, whether it's a divorce, an illness, a hospital closure, a change in your mind, maybe you aren't as happy as you thought you'd be. So, and also there's such a thing as high risk, low probability events you have to be aware of. And I think these are all things that I was never really taught, and I teach my kids about them now. But I think my approach was almost kind of Forrest Gump-esque. Like I kept going, where the stream was taking me. And that can work out because ultimately if you're talented and you're driven and you're ambitious and you ultimately reach a point where you just have to make some decisions for yourself. I just wouldn't have waited till I was, 45 years old to do that. I think, I know some of my contemporaries who've been very successful have been much more prescriptive and organized in each of their decisions when it comes. They're always thinking, okay, if I take this, my next step is this. The trouble with that approach, not that there's anything wrong with it, is there are really two kinds of leaders. There are what are called gold star leaders and there are North Star leaders. I've met a professor at Berkeley who came up with this concept, and I had her on one of our brain turnship lectures that we have like 13,000 kids signed up for these virtual brain turnships now. And the gold star leader, and most leaders in healthcare, really accomplished surgeons for that matter, are gold star. They worked hard in their residency. They did what they were told to do. They got very good at something. They had, mentorship. They, worked with someone or with a group. They got recognition. They wrote papers. They got grants. Maybe they were in a private practice. They developed a referral base, dinners and schmoozing or papers and conferences. It's all the same stuff, whatever trajectory you're on. And you keep making incremental progress, along the way. That's gold star. A North Star leader, who I consider myself, is someone who has a vision of themselves and their beliefs and what they want to do, the contribution they want to make. And if you look at gold star leaders, tend to be in banks or government. I think, potentially in certain Fortune 500, like more mature companies, GE or a Ford. These people work their way up the food chain until they become leadership people in their departments or their companies. A gold star leader is like a Steve Jobs or an Elon Musk, who kind of, there are fewer of them because it's hard to do and it's more random and probably more risky. But you have to know yourself. I've never been really comfortable with the conventional wisdom. I was willing to take risk, probably because I didn't really know better. But I was also very, very self-confident. And I don't really care what other people think. And I don't look at what other people are doing. I don't look at someone else and say, I wish I was like that. I kind of just do my thing and assume I'm doing the best I can. It's like I was a rower in college. It's like, you don't look out of the boat. You don't make yourself going faster by looking at your competition. So you have to sort of know yourself. And I think the best advice, no matter your resident fellow, is you got to know yourself first. You have to know what makes you tick. You have to make sure, number one, that whatever it is that you do and that you love it. If money should never be your focus. If money's your focus, you're much more likely to, make decisions that are errant, especially at the beginning. And the most accomplished people in general probably made a little less when they started. Once you kind of suck up to a higher salary or in a worse job, your lifestyle changes, your fixed costs go up. You become kind of like, it's hard to break that. And so if that's what you want, if it's fine. I mean, that's where your heart is. I'm not going to tell you I have nothing against that. It's not me. And most people who are really successful, money is really never the goal. It can't be. It doesn't mean you can't make a lot of money. Now, maybe your goal is making a lot of money at the exclusion of everything else. That's why you go into a financial becoming Wall Street, or where it's just making money is fun. You're making deals. It's just about making money. That's still different than just making money. It's different of how you're getting paid versus the mechanical aspect of making money. And I think money is a very stressful, disruptive influence in healthcare, because it's very often your decision making and the decision to do something, when it's related to money, it can go counter to what's really the right thing. And so the sooner you can, I think, personally disconnect from that and focus on doing good work, whether it's research, clinical, administrative, and then being paid for it, being paid for being good, not being paid for being paid. I think that's the best advice I can give people. And I think that's remarkably important no matter what your profession is, because trust me, when money's your North Star, you're much more likely to be unhappy. It's never enough. It's always more. And it's like Sheryl Crow says, it's not having what you want, it's wanting what you've got. And especially as a physician, I think that has to be driving you, or else you could really screw up.
So what would you say were some of the keys to your success that shaped your early career that helped you climb to the top of the industry?
I think I was in a good place. I think my university, I was at Penn for 17 years. I had very good training. I saw the best of medicine. I knew, I was exposed to very good scientists who taught me not so much about science, but thinking. In fact, the woman that I worked with as a resident and medical student is now the core scientist behind Moderna and BioNTech's RNA vaccines for COVID. I mean, she's the best scientist I've ever worked with in my life. And she's made hundreds of millions of dollars from her ideas. And she was never about money. She was Hungarian communist. I mean, she was, basically focused on the science, just stepped in, it was like La La Land. So that you were surrounding yourself with the best people. I also think that another reason for my success has to do with the people I've met along the way and being brutally honest and never taking advantage of anybody on my way up. And there are people I haven't liked, and certainly there are people I haven't gotten along with, but I haven't really screwed anybody. Like I always try to make the best of the situation, because you can always count on those people later. When you're unethical or selfish or non-collaborative, you never know down the road when that person's going to come back. And so you take risk. You have to. Now, if somebody's a jerk and they're just, trying to screw with you, you defend your turf and you push back. But that doesn't mean you try to hurt them. They'll hurt themselves. So you don't even worry about it. And I think that my mantra is identify the best people to work with, develop relationships, be honest, be ethical, make myself the best I can be. When the time comes for me to make decisions about my career, about who I'm going to work with, or about, a department for that matter, I'll have to be my confidants, my partners, or my coworkers. And it's worked. I don't think I thought of that volitionally back then. I wasn't smart enough. But, I've always been that kind of person. And, it's just who I am in my nature. And I'm very blessed by that. I can't say I do it. I just do it automatically.
So dealing with residents and fellows, and now that everything is basically virtual, even our annual conferences for all the subspecialty associations and conferences, what type of advice do you have for them when they're trying to reach out to folks like yourself and they don't have the ability to do it in person now?
Well, I think that's the great thing. I mean, I think, even this meeting today, 4 months ago, this probably wouldn't have happened. I think you've identified this medium as a tool, and it's a new, powerful tool. And so I think my advice is use this, take advantage of it, reach out to mentors or people you want to work with and offer to do a Zoom call. People have time. We all want to meet good young residents and fellows who want to work with us. And if tell you what, if they aren't into it, then it's probably not somebody you want to work with. I mean, you want to use the tool to find those people. And you can, these are remarkable, you can really get to know someone on a Zoom call. I find they're more stressful, I think, But I tell you, I think you're forced to be a little bit more of yourself. You can't sort of get away with some of the things you can do in person. And you're required to be, it needs to be a little more entertaining. You have to, find the best way to use the medium to your advantage. And so my recommendation would be use this. Don't be afraid of it. Reach out to people, say you'd like to meet them or talk about your research. Or I'd love to hear, just schmooze them a little bit. Hey, I hear you're a great surgeon. I'd love to hear your advice. Or could you spend 20 minutes with me on a Zoom call to talk about your job or where you came from? And people love to talk, especially the people, real leaders. They want to, I use these things as sort of reset buttons for myself that, they're therapeutic to talk about, where you're going, where you've been. And it gives me a lot of gratification from doing that, especially to young people. So they should use these. It's not a bad thing. The training's the same. I mean, they're going to, in the in-hospital training, the patients are all coming back. If we shut down for 2 months, the residents weren't operating for a little while, but now they're back. Look, if you have to do another few months afterwards, you do it more few months. It's never over. Training is not beginning and end. It's a continuum. I did a fellowship 10 years after my residency ended. I mean, you never stop training. And you always have to have an open mind about new learning, new ideas, and also that goes, especially in surgery, the technologies and techniques that we're using today, I used exactly none of them when I was a resident. So you always have to reinvigorate yourself and, open because, like I remember, low prob, high risk. I mean, all of a sudden you're fat and happy doing something a certain way, and then somebody reinvents the wheel and you're caught because you weren't paying attention. So use these, chaos, all this stuff. This is this is the way to, man up and women up to this, because this is the way, the future. And we're not going back. If people are relying on old ways of doing business, they're going to get killed. And you're seeing that. I mean, you're seeing in retail, there were businesses that were really slipping before COVID. Now it's just accelerated their demise, and they weren't prepared. And it can happen in healthcare too. I read a lot of books like during the Great Recession. The bankers and all these Wall Street guys, they ultimately did okay. They suffered for a few years, but they're kind of prepared emotionally for risk. They know that you have good years and bad years. Doctors aren't. Doctors are kind of pig-headed. I'm smart. I did all this work. The world owes me a favor because I'm so talented and I've worked so hard. That's a bunch of BS. No one really cares. And the truth is, if you're not prepared for risk, physicians are terrible at managing risk, because things, go pretty well for a certain period of time, and you're not aware that all of a sudden they could shut the hospital for 2 months, and I'm on an RVU or a cash contract. You're in trouble. So, and then what you end up doing, you get coming back and you try to catch up, and you're on a freaking flywheel. So, that's not healthy. So I think that the key is really being aware that things change. Always, be at the cutting edge, or if not at the bleeding edge. Be aware of things that can eat your lunch, and then make sure you're, paying attention to yourself, and, you may want to see where the world's going, but, don't be worried about the guy down the street. Just go do your own thing.
Now, if you guys being out in New York and kind of at the center of everything going with the pandemic, can you kind of just give us some insight into where you see it going and potentially the future outlook on it?
They will be okay. Eventually this is all going to be okay. I think New York's going to go through a really bad few years because of the tax base going away. I think the red states have lower taxes. A lot of the money is moving into lower tax areas. It's been accelerated by COVID, especially because the cities are becoming a little bit more stressed. The public transportation, the services, the police, these was tax base drops. No tourism. It's a place that really relied upon external monies coming in are really in trouble. I think Vegas probably being the worst. But so there's going to be this shift, I think, of resource very, very rapidly. But New York will come back. New York always will come back. It'll be okay. As far as COVID coming back, I'm skeptical. I think that I would have thought we would have seen a rise, and I think we probably will see some increase in COVID in the fall and the winter, but I don't think it's going to be nearly as bad. Remember, we wear masks to protect ourselves from spreading it, not to get the virus. We did it so that we wouldn't overwhelm our hospitals, especially older people. But young people, when they get it, in general, aren't as sick. We always hear about all the death and destruction amongst young. It's very rare to die from COVID as a youngster, or even in your 30s and 40s. Does it happen? Sure. But the vast majority of people that died are elderly or infirm. And so it doesn't mean you shouldn't have some concern, But by the same token, the reason to wear a mask is to prevent yourself from spreading the darn virus so that it doesn't pass on to people who are more susceptible to dying from it. And if we can do that, we can keep the limits of the numbers in the hospitals where we've gotten much better at knowing how to care for people, especially if they come to the hospital before they get too sick. And we can probably prevent some rapid progression by hitting them with steroids and diuretics and early recognition of pneumonia. We understand how to keep people off ventilators now much better than we did originally. And so I do think that the therapeutics are getting better. At the same time, we'll probably have a vaccine by, maybe even by the end of this year, early 2021. And I would expect this to be a manageable pandemic if it does come around again. That's my gut feeling about it. And, it doesn't mean we shouldn't be, careful, but I also don't think we're going to have this massive, overwhelming wave of patients like New York saw, because we had 2 months went by February, March. We didn't even realize it was here. It was just another, and so all that was just, came all at once. Whereas around the country, we're seeing this sort of second wave because they never went through the first wave New York did. So I think their overall, herd immunity has not occurred. And then they opened up too early, and now they're seeing the second rise. So the super spreaders are getting infected, and young people, and unfortunately, they're all suffering. Maybe not as bad as we did, but suffering nonetheless.
Now, as a personal fan of Lenox Hill on Netflix, can you kind of just give us some quick insight into how you got that going and where you see the future potentially for the show, maybe a season 2?
To go to the second question, I think that I think, first of all, the people who watched this loved it. But if I was, a 30-year-old guy coming home after work, am I going to turn on a hospital documentary? Probably not. The people who've watched it are in healthcare, they're professionals, they're empathetic, they're maybe even people talk about leadership, people who talk about these things. So I think that the overall rate of people seeing it was probably a little less than, we know people who watch it because they're in our world. But I get the feeling, we've seen our social accounts sort of plateau off. You can get an idea of when this thing peaked. And I think it's been very impactful to the right audience, but I'm not sure if it's been impactful enough to warrant a second season, number one. Number two, I don't really need a second season. I think that I'm not an actor and I'm a doctor. If I needed another show to could I be more of a celebrity? Sure. Could I be more popular? Yeah. I mean, it's been honestly a little uncomfortable. People ask what it's like to be a celebrity. Well, I'm not really considering myself a celebrity. I'm a local, flash in the pan celebrity. But people look at you differently. They're a little nicer, and my kids think I'm cool. That's basically what happens. I mean, the kids think I'm cool. My kids think I'm cool because I have more social media followers. People look at you like they recognize you. It's a little odd. And people are nicer to you because they know you from seeing you on a show. I don't have to explain what I'm doing every day. I think that's maybe the best thing. There's a recognition that I'm doing something good, that I'm good-hearted, that I'm empathetic, and that I care, and they give you a little bit of a pass. And so that's pretty nice. I think that's maybe the best thing. But I'm certainly not I don't need it, and I'm going to still be a surgeon. I like being a chairman. I want to grow our department. And actually, that's the way it came, going back to the original, idea about what you do to build your career. The way this happened was very simple. I had an Israeli fellow who I was training, and I really respected him. I took care of him. I taught him everything I knew, and I wanted him to be great. And I, wanted him to be successful. I felt that he had the right stuff, and I did everything I could to encourage him, to, always call him when I had something interesting. We did research together. We wrote papers together. It just so happened that this guy was in a show called Ichilov in Israel. When he was an Israeli resident, he was in the show in Israel. That was the progenitor to Netflix, was to Lenox Hill, was an Israeli show called Ichilov. And Erez was in the first season of Ichilov in Israel. And it was a huge hit on Israeli TV. And the producer and director were a couple, Ruthie and Adi, decided to come to the U.S. because the new Israeli TV market is tiny. And Ruthie in particular had this idea of getting a streaming platform. This is 2016. Netflix wasn't nearly as big as it is now. So they came to the U.S. and they called Erez. They said, hey, can we do a show with you in New York? He's he had just gotten a job. He says, there's no way I can pull this off where I am, but you ought to call Dave. So I met them. And if I had that kind of relationship with Erez, why would he, if he was selfish, if he wasn't such a good person, he would have done that. And if I was selfish, if I was, didn't give him all of me, he wouldn't have respected me as much and wouldn't have felt as comfortable, basically putting them in touch with me. And that's how it started. They called me, I met them for dinner, and I said, I'm going to try to get this done. So it took me a year to sort of get all through our marketing, legal, the C-suite, Lenox Hill administration, the union. There's a lot of work to get all these people signed up. And then Netflix signed a deal, towards the end of 2017 and funded it. That wasn't a fait accompli either. It could have been Amazon, it could have been Hulu, who knows? And it just hit at a perfect time. Then COVID, you could have asked for a more unique moment for this to come out. I think it probably hurt our ratings a little bit, but by the same token, the people who really looked at it and saw it, it was so much more impactful, especially the 9th episode. So it's all luck, but you make your luck. You meet the people who you meet, you make decisions you make, and all you can do is the best you can be, and then you let it rip. And I can't say that works for everybody, but that's what North Star is. And I'm very grateful for this opportunity. I'm super lucky, but I work my ass off, and I hopefully we can continue to grow and prosper and do good work. That's the essential underpinning of everything.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.